Today I'm going to be talking about eating disorders at NYU. Going into this project, I thought I was going to pose a critique of the diagnosis process, but instead I took a different approach. My primary question is, how can we perform outreach to people with eating disorders at NYU? And my secondary question is, how can we free up more time for the staff to perform outreach and help more students in need? From my research in the form of interviews with people who worked at NYU's eating disorder treatment team, I found that there wasn't enough outreach being done to people who may be struggling. Part of this is because, like most counseling centers, NYU's counseling centers are understaffed and they already take on so many tasks as it is. For example, there's only one dietitian on this campus and she Skypes with the global campus and she partners with the dining halls, but that's really the extent of that because she is so booked that it was probably a miracle she was even able to meet with me. Secondly, there was no prevalence rate for eating disorders on this campus. We don't necessarily need one to know that many people are struggling given the national prevalence rate of campus eating disorders, but it would be helpful to have NYU-specific statistics, especially when performing outreach, so that we know who to aim that outreach at and how to tailor it. I would focus on getting the opinions of students as well. My dossier, which would be to Dr. Lewis Marshall, who oversees the team, as well as the people above him, would propose performing outreach as a crucial step, of course. I compare our efforts with the efforts of the University of Illinois at Urbana-Champaign. At the U of I, they have readily available brochures spread everywhere from various advising offices to cultural centers, and as in the cultural resource centers on that campus. And these brochures are even available online. One can order a pack for a very minimal price. The university also has a clear plan for National Eating Disorder Awareness Week, in which they discuss eating disorders as they relate to sociocultural factors, a topic that has proven to be important on a week that has proven to be important for outreach. In my dossier, I also propose a few other plans of outreach that the University of Illinois does, such as partnering with campus leaders through a weekend of seminars about how to deal with this topic, and giving students course credit for helping perform outreach about this and various other mental health topics depending on their interest. Some of these programs are things to aspire to long-term because funding may be an issue. Based on the results from the U of I, the outreach should be effective and more people should feel comfortable seeking support and know how to seek it. I also attached a chart about performing or preferred outreach strategies by demographic. For instance, women are more likely to prefer campus courses than men, and people of color are more likely to prefer campus activities than white people. So professionals can keep this in mind while forming a plan for workshops and for NEDA Week. Finally, I have attached a chart about screening for eating disorders and prioritizing it based on severity with the incorporation of online training. This should help lessen the caseload of the staff while making sure that they're helping students who are struggling severely. Right now, the treatment is on a first-come, first-served basis, and that might put some students at a disadvantage. This new system will disrupt that disadvantage. Thank you very much for your time.